Good morning, everyone. I'm Dr. Kalpana, Senior Lecturer from Department of Pediatric and Preventive Dentistry, SRM Dental College, Ramapuram, Chennai. The topic for the e-content today is teething. So, as for the synopsis, we're going to see about the introduction of teething, signs and symptoms, management, and teething problems. As we move on to the introduction, what is teething? Teething is the eruption of teeth, is the movement from the teeth from their pre-eruptive position in the alveolar bone through the mucosa into the oral cavity. It is given by Carpenter in the year 1978. So basically, the appearance of the first tooth is regarded as the significant development landmark for most of their parents, and as the old wife tales regards, is the precocious eruption as a sign of the great intelligence. And again, it can be difficult and distressing for both children and also their parents. And according to Macken et al. In 2000, teething is not a single day eruption, it's an 8-day window period, which includes 4 days before the tooth eruption, the day of the eruption, and the 3 days after the eruption. Moving on to the prevalence of teething, Kunha et al. In 2004, he said primary tooth eruption causes around 95% of the problems. And according to Noor Mohammed and Basha in 2012, during the primary tooth eruption, 68% of children is having certain kind of disturbances during the eruption of their teeth. As we move on to the signs and symptoms, most of the children have various different signs and symptoms which will not be similar for each children. So what is the usual thing they will be associated with is the pain in the site of the eruption of the tooth and fever, inflammation of the mucosa overlying the tooth, possibly there might be a small hemorrhage. The treatment is not actually required. General irritability, malaise, disturbed sleep or wakefulness, facial flushing or succumoral rash will be seen in certain children. Drooling is more, and gum rumming, biting and sucking is more common or frequent during this time of teething period. Bowel upset, some kids will have vomiting and diarrhea also. Loss of appetite, alteration in the volume of fluid intake by the kids, hair rubbing on the same side as the teeth erupting. As we go on to the management of teething, there are various classifications divided as a form of non-pharmacological management, pharmacological management, alternative holistic medicine, and general advice. As we move on to the non-pharmacological management, there are wide varieties of teething rings available in the market. Basically, ask the child to just gnaw on the teething ring, which will basically help the child to soothe the teething pain. So you have liquid-filled teething rings and the superior solid silicone teething rings. It is always better when compared to the liquid filling because you don't know what type of liquid it is present inside. And this helps as a temporary pain reliever because there's a pressure applied onto the gums when the infant is biting onto the teething rings, and it has a better benefit when you put the teething ring onto the fridge and give it as a cool substance for the children. And again, this can be attached to the infant clothing, and re-washing and sterilization of the teething ring is again important when the child is reusing even on the same day. Other than the teething ring, there are many hard non-sweetened rusk and biscuits available in the market as a sweet cream, and it's even available in many Amazon, like many different markets. And they can give chewing breadsticks. Hardened breads can be given, and in a very easy way, certain vegetables like carrot and cucumber can be cut in a long stick and which can be kept in a freezer and can be given onto the children. But again, care has to be taken care because some of the parents has to be near to the child when the child is biting or giving pressure onto these substances, because any aspiration or choking is very essential. In certain area, even pacifiers can be given. So when we move on to the pharmacological agent, what are the topical agents? Basically, it includes local anesthesia and minor analgesic. So basically, when the parents have asked to apply certain gel onto the erupting area, and the parents are mostly advised to wash their hands before they apply any kind of gel onto the child's mouth. Before they go on, there are lignocaine based gels. These are is available in the market as Dentinox and Calgel. So basically, it is given in a certain formulation. A smear layer or 7.5 grams of gel should be placed in a clean finger, or it can be taken on a cotton bud and applied onto the area of teething. And patient has to be kept as such. Although 20 minutes time gap can be given before the other application, and you can apply 6 times per day. Next is choline salicylate, which is a cholic acid bone gel or T-gel can be applied available in the market. So again, same quantity. Parents has to wash their hands or in a cotton pad. Quantity of this bone gel can be taken and applied onto the pain area. So again, which can be repeated around 6 application per day or 4 to 5 hours. The application can be repeated. And if the child is going to, if the mom is going to apply for a frequent application, burning is essential. Again, over application of the material can cause severe deleterious effect onto the child's health also. Next, we move on to the systemic analgesic. Most of the teething child is most commonly associated with pain and also fever. So for that, analgesic like paracetamol can be given. So it depends on the child's age and the weight. The doses has to be calculated by the pediatrician and which can be prescribed onto the child. And there are certain alternative holistic medicine like acupressure. So there are various points in the child's head, palm and the toe, which can be pressed for certain amount of time, which help in reducing the pain temporarily only. And there are certain things called as aromatherapy, which basically use essential oils, which helps in massaging the and neutralizes the inflammatory mediators produced during this teething, and which also can be placed in the aromatic diffuser in the bedroom where the child is playing or sleeping. And we move on to the general advice. So basically, parents should be advised to not do certain outdated practices, and certain things are harmful because in certain places in India or also in Africa, the first erupted tooth is not considered as good for the parents, and certain extraction of the tooth is happening here and there. And in India, there is during the eruption for reducing the pain, they're taking a coin and rubbing onto the gums until the bleeding comes is also happening in certain places of India. So these can be harmful for kids, and please don't follow these things in this certain period of time. So adding sugar, honey or jam to this feeding bottle or the pacifier, dipping the pacifier can cause deleterious habit because it is highly carcinogenic, and again which can interfere with the digestion of the children, and again it has no pain relief effects also. And give sugar-free object and medication to the child during this teething period, and please don't overdose your child even if your child is nagging, crying of pain, or if the child is having any eye fever. Because Alexander 1978, he basically reported an overdose of salicylate containing teething gel poisoning, and the child has lost his life. And teething remedies should be kept well out of reach of the children. That means if you're adding any kind of medication or all, the child should not have in contact with that. And medicine, including teething remedies, should be avoided. You should not add this in your food or the feeding bottles, because you can't calculate the dose accurately for your child. So as we move on to the teething problems associated with the teething, there's something called as eruption hematoma, where there will be a small, slightish balloon-like thing erupting around the toothing surface. It will appear in bluish, green or red in color, which basically is a self-correcting anomaly where it will get healed on itself. Next is eruption sequestrum, ectopic eruption. Ectopic eruption is erupting at a different period, a different site of the tooth, which is abnormal from the normal path of eruption. Natal and neonatal teeth, these both are the teeth which erupts very early to the normal eruption period, where one the child will be born with the teeth, whereas the other one the tooth is erupted 1 month after the child is born. Again, most of the tooth will not have a proper root surface, which will be mobile. In case if these teeth are causing certain problem like interfering with the food habits of the children, if the child is having any kind of irritation or ulcers onto the tongue, removing of these teeth is very essential. Again, non-eruption of the teeth is also possible. Submerged tooth, delayed eruption of the permanent tooth is also seen. These are the certain teething problems associated with the teething of the children. Last, as we move on to the conclusion, there are various beliefs and superstition associated with teething is present in various history in various places all across us. But certain concerns has to be taken whether to have to follow these kind of practice even today in today's environment or day-to-day life. So there should be a proper diagnosis before you start and give certain medication onto your child. So proper care has to be taken during this teething period, and certain washing and sterilization of the teething rings is again essential. So considering the accepted method of pain removal without causing the injury or damage to the infant is again very important. Thank you.